and welcome. I am Tanya Winters, the President and CEO of Allergy and Asthma Network, and it is my distinct honor and pleasure to welcome you all today to the Allergy and Asthma Day on Capitol Hill 2022. After a 2-year hiatus of being all virtual, it truly is a pleasure to be back here in the Rayburn House building, and we are so grateful for the staff, especially the help of Hannah Salazar and Representative Deborah Dingle's staff for getting us to this point today. For without the support of these members, we would not be gathered here in this room after, again, a very long 2 years. We also want to welcome our online community. We have over 300 people registered to participate in our lunchtime briefing today as we help to raise the awareness and the policy priorities that are affecting the more than or close to 100 million Americans living with atopic and respiratory conditions. And so I couldn't start our program without first just thanking our sponsors and our supporters, our corporate sponsors and supporters of being here today, as well as our professional society supporters of the American College of Allergy, Asthma, and Immunology. It's a long-standing partnership that has allowed us to work together on hosting this annual day on Capitol Hill. So as we get started, again, welcome. And the program today is one that is going to focus on the highlights of our 2022 policy priorities, as well as provide updates from several agencies that our community benefits from the service of their regulatory efforts in our U.S. healthcare system. And so we'll hear from the American College of Allergy, Asthma, and Immunology's president, Dr. Mark Corbett, and then we'll also hear from EPA and NIH before also sharing a few of our own policy priorities and the things that we are here talking with members of Congress about today. But as we always do, we like to start with the why, the mission of why we are here. And it really comes down to the work that we've been doing at Allergy and Asthma Network and the work of our community since 1985, which is working together to end the needless death and suffering due to asthma, allergies, and related conditions. At the network, that means that we work in 4 key mission areas: outreach, which is driving awareness of these conditions; education, which is developing evidence-based, guidelines-based education materials for patients, caregivers, and healthcare providers alike, as well as policymakers; advocacy, which includes our state and federal advocacy efforts, as well as our regulatory policy efforts, and our payer policy efforts. So we work in all of those realms to ensure we can get the right treatment to the right patient at the right time with the fewest barriers. And then finally, our research mission area, where we are devoted to bringing the basic and clinical science into the real world through translational research and focus groups, surveys, recruitment and retention in clinical trials, and specifically diversity in clinical trials. And so you'll hear a great deal about some of our efforts and work and how this ties into our policy priorities today. So what are those policy priorities? What are the things that matter most to those close to 100 million Americans? Every day we have helpline calls to the network, we have emails to the network, we're engaging in local communities, and these are the things that we hear are the greatest barriers to care. First of all, access to medical care and treatment. We know that even once you get that appropriate diagnosis, then how do you get access to the right treatment? And especially when the treatment may be new or innovative, and again, when you have been living with this condition for a long time. So that is a policy priority that drives a lot of our activity and engagement and some of the specific asks that we're looking at here today. Secondly, asthma and allergy program funding. We know that the continued need for fiscal 23 to have funds dedicated to allergy asthma research, as well as to ongoing programs at CDC for National Asthma Control Program, EPA, HUD, HRSA. We have a number of asks that we're including in our continued support for asthma and allergy program funding. Reducing health risk for allergy and asthma emergencies. So over the years, Allergy and Asthma Network has really been at the forefront of ensuring that students have access to their emergency medications, whether they're in the school setting, in the daycare setting, if they are in a public setting. And we have advocates here who have actually then moved that effort forward in their own states and are beginning to implement that stock albuterol and stock epinephrine throughout the rest of the country. And we are so grateful for the collective efforts at both the federal and state level to advance that policy priority. Next is the mitigation of environmental health hazards. This includes both indoor and outdoor air and clean water. We know the importance, especially for those of us living with compromised immune systems and or lung health, of the importance of clean air and clean water, whether that be indoor and or outdoor. And so we'll hear more about that from our partnership with EPA in just a bit. And then finally, COVID-19 prevention and treatment. We would certainly be remiss in not having a policy priority in relation to the pandemic that has dominated the headlines and most of our personal lives for the last 2 years. And so again, at the network, we sprung into action in March of 2020 and began working diligently to ensure that we had equal access to COVID testing, to address COVID vaccine hesitancy, and now even to move into COVID-19 treatment access. And so we're very excited about the work and some of the legislation and policies that are being put forth and moving throughout Congress to support that COVID-19 community and especially those long COVID patients. So it's always our pleasure to welcome members of Congress into our lunch briefing each year. And this year, unfortunately, the House is on recess. And so we were honored that Representative Debbie Dingell from the great state of Michigan would actually record and spend some time with us from her home today. So I will play her video now.
Good afternoon. I want to thank everyone for being here today and tell you how great it is to be with you for the Allergy and Asthma Network's Advocacy Day on Capitol Hill. More importantly, thank you for your unwavering commitment to this cause. As you all know, you wouldn't be here if you didn't. Nearly 25 million Americans suffer from asthma, and more than 50 million Americans suffer from allergies. My home state of Michigan has one of the highest prevalence rates of asthma in the country. Together with my Allergy and Asthma Caucus co-chair and my dear friend Fred Upton, we've recognized this month as Asthma and Allergy Awareness Month to bring awareness of the health and economic concerns tied with asthma and severe allergies. These chronic conditions plague Americans of all ages, genders, and backgrounds. But they pose the greatest threat to the underserved, the elderly, and our children. Our work doesn't stop there. We have at the caucus requested increased federal funding for the U.S. Centers for Disease Control and Prevention's National Asthma Control Program to help states monitor and treat asthma. And we have requested updates to food labeling requirements to protect those with severe allergies from accidental exposure to hidden allergens. Together with Representatives Upton, Fitzpatrick, and Blunt Rochester, we've introduced the Elijah E. Cummings Family Asthma Act, named after my dear friend, who was a tireless advocate for those living with asthma. Our legislation expands the CDC's National Asthma Control Program to all 50 states. The program will increase asthma education and awareness nationwide and will help those suffering from asthma gain access to the treatment that's right for them. We also understand the need to bring greater relief to individuals and families, and we're fighting tirelessly to expand access to high quality, affordable health care and to lower the out-of-pocket costs of prescription drugs. I've met too many people that are paying ridiculous prices for prescriptions and who have watched the cost of drugs exponentially increase. For me, One of the reasons I feel so strongly is the mother that was working 2 jobs, living below the poverty line, and had a child with asthma. She told me at a town hall meeting that her child's inhaler cost her $800 a month, and she had no insurance. Mothers shouldn't have to think about that. Inhalers save lives and should be affordable. No family should ever have to choose between feeding their family at the table or giving their child a life-saving drug. And this is even more critical for those living with chronic conditions. Asthma and allergies are so important to treat. And with treatment, you can live a very normal life. It's clear that more work is needed to make sure children and adults who are suffering from asthma and allergies have access to the medicine that helps them breathe and gives them quality of life. And that's why I am so heartened by your efforts today. By sharing patient stories and boosting awareness of asthma and allergies, you play a key role in educating lawmakers and educating the American public. I'm not going to stop. I promise you I'm going to continue my efforts here in Congress to bring the help that you need. Whether it's through funding for research or legislation to lower the cost of healthcare. I plan, by the way, on introducing legislation similar to that of lowering the cost of insulin for inhalers because people don't know how expensive those inhalers are. And I know that our combined efforts are helping Americans across the nation lead healthier lives. Thanks for inviting me to be here with you today and for your dedication to ensuring no more lives are lost to these treatable and manageable conditions.
Thank you, Representative Dingell. Again, such poignant words for such a time as this. And definitely, again, Representative Upton sends his regards as the co-chair of the Allergy Asthma Caucus. He has been with us in years past and sends his regrets today. It's now my pleasure to bring to the podium Dr. Mark Corbett, who is the current president of the American College of Allergy, Asthma, and Immunology, to provide us with the current state of allergy and asthma in the U.S. Welcome him, please.
Just the Aero Center. Thank you, Tanya, and the college, again, thanks you for the efforts you've put forth, and we've had at least 2 or 3 decades working with Allergy and Asthma Network, and certainly look forward to continuing that relationship as we move forward. So basically, despite the advances we've had in diagnosis and treatment, we've had guidelines from the NIH, I guess 20 years now for asthma, we still have issues in treatment of allergies and asthma in the United States. These do have a profound effect on the daily life of our patients. We know there are racial and ethnic disparities that create barriers to care. Environmental challenges are likely to increase. In fact, with global warming, that increases pollen counts. Good for my business, not good for the patients. But again, that's also an issue. COVID-19 obviously threw a wrench into everything and uncertainty in patients' ability to get into the office and get their treatments that they needed. And the economic realities of healthcare, as the Congressman just mentioned, limits the ability for the patients to get care they need. This slide, Tanya had up this morning, but it's good to go over. There are about 25 million patients with asthma. 1 in 10 children have asthma. Costs associated with asthma care with medications, hospitalizations, missed work at school borders on $80 billion. And this is 2019 data, I believe, so it's probably even higher now. And just a variety of things. And the point I'd like to make on this, yes, there are fatalities and issues with allergic diseases, but that's not really like we're talking like cancer or heart disease, but it's a quality of life issue. I mean, these are patients in their formative years, children in school, young adults, and they're miserable and they can't function. So it's really more quality of life. And if you do surveys on quality of life with allergies, just allergic rhinitis, these patients score as poorly as patients with heart disease. So again, it's a huge issue, and this people in their more productive years of their life. As far as the environmental allergies, we know 1 in 5 patients in Kentucky area, it's probably more than that. We seem to win the award every other year or so. Again, about $8 billion in costs. And we know that probably a majority, especially of children with asthma, do have environmental allergies also. And again, the life-threatening allergies, obviously these are the ones we worry about the most. There's patients with the food allergies, and we know 1 in 12 children have food allergies, and I'm reading on Twitter all the time about parents still having issues and barriers when they're on airplane flights, and people downplaying the, oh, you've got an EpiPen, what's the matter? They just use that. So, I mean, again, there's still a lot of information we need to get out, and you guys are doing a great job with that. About $25 billion in costs there. You have fatalities for about 150 to 200 for foods, about 40 with stinging insects, 400 with medication. So again, still way more than we need. We want to get those numbers down to 0 if at all possible. What's been going on recently in the field? Well, we understand now that asthma we thought was one disease, but we realize now that's not really the fact. It's really a spectrum of diseases, and patients, depending on their biomarkers and their other confounding factors, fit into a different category. So it's not just one size fits all. So with that, we've got new routes of administration for allergy immunotherapy. We have allergy shots for years, but now we've got oral allergy immunotherapies that have been FDA approved. We've got increased awareness of food allergy prevention. We, unfortunately, when I was coming through my pediatric training and early allergy training, don't eat peanuts, eggs, fish till you're 2. You know, we realize now that was a total mistake and probably increased the prevalence of peanut allergy that we see now. And we've addressed that. And again, we're trying to get that information out to the pediatricians and the public. Made progress in identifying allergy and asthma phenotypes. So now we can actually, by doing lab and looking at biomarkers and other factors on patients, we can identify a particular therapy that may work best for that individual patient. We continue to do that with biologics. I think we've got, 7 now in treatment for allergic diseases, and there's more being looked at as we speak. Smart inhalers have come out, so if you have a problem with the patient not being able to take their inhaler, you can now gauge that with the smart inhalers and determine if they're really getting the inhaler in. And again, as we'll reiterate, racial, ethnic, genetic, and environmental differences occur in our patients, and we have to be aware of that. What are the college focuses? Well, I think the major focus in my presidential initiative is there are a lot of people out there claim to be allergy specialists, but there's one group that are board certified allergists, and that is our group. And we have the 2 to 3 years extra of training, and we really focus on that as disease. And I don't think a lot of the primary care physicians realize there's a difference, and we're going to try to get that message out to the primary cares. We've already got an initiative we've started where we're getting that message out to nurse practitioners and PAs on what the difference is between a board certified allergist and their training and other people that may be practicing allergy. And we just hope that, again, our specialized training can be more helpful. We continue to support the allergy community with the latest on COVID, again, along with AAN's work to decrease racial disparities. My predecessor, Dr. Fonestier, that was her initiative last year, was trying to overcome racial disparities in our specialty, and she had a lot of good initiatives that we're still working with. Promote and publish world-class research, and we continue to develop resources for the healthcare professionals and the public. We just updated our website. I think Dr. May did a lot of work on that. We've got a brand new public and website for our members with a lot of new information. We're getting about 400,000 to 500,000 individual hits a month on our public website. We have a great meeting every fall, and our meeting, if you get to come to it, is more just practical things that a physician can take back or NP, PA can take back and use in their practice. So we don't have as much on the bench research as some of the other organizations do, but more practical things to help patient care. The meeting this year will actually, I don't know if this is the first time ever, but it's going to be in Louisville, which is my hometown. So I welcome everybody. You'll have a great time. So yeah, well, Ben, I don't know if there's ever been a meeting in the president's hometown either. So we are providing more physician education and patient public information in Spanish, and we're looking at other languages depending. Raising awareness of our website. Again, when I said we had 400,000 individual hits per month. Continue to work with lay organizations. We will continue to move forward with AAN and others. And again, amplify that the college is the advocate for the allergist in practice. Again, what have we done recently? Well, with AAN, we did create the Eczema and Skin of Color campaign last summer. We're still working on that, getting the information out, because it isn't the same in white versus Hispanic versus African American. And again, we're trying to get information out to our physicians to know that. We have yardsticks, and we just finished a chronic rhinosinusitis yardstick. And these are just sort of like a guideline, but they're more flexible. So our yardstick, we can update those much more frequently to get all new information and any new drugs that come out, so that allergists and our membership have capability to get that information quickly. We have shared decision-making tools for nasal polyps and peanut oral immunotherapy, which they can use. And our telehealth toolkit and coding kit have been revamped, and we're really doing a lot to help the allergists in the practice and overcome the hurdles administrative that we have to deal with the regulations. We have new webinars, podcasts, CME offerings, a lot of them on health equity topics, including food allergy, primary immunodeficiency. We're going to have a white paper we're putting out on racial inequities with food allergy and eczema, which should be published hopefully in the next 6 months or so. Updated toolkits on allergy and asthma awareness. Here we go. We're working with the American Academy of Pediatrics on food allergy and school setting information, reviewing and providing comments to the American College of Physicians document on physician payment reform, and also working on increasing the availability of pheno to use as a screener for asthma. What are our 2022 priorities and advocacy? Well, we're going to advocate for continued coverage of telemedicine benefits. We think that's very important. And we think the one positive that may have come out of this whole COVID pandemic was the use of telemedicine, because it allows us to access to patients who may not have been able to get in. I mean, several of us have talked about stories of patients that have to drive for hours to get there and can't make that. This gives them the ability to get good care, hopefully by addressing their concerns early. We keep them out of the emergency room and keep them healthier. Reduce burdens on prior authorization process, which is becoming more and more of a hurdle for practices. We're have fixed problems with patient allergen extracts. For instance, venom issues. Venom at the current time, it costs more to give the venom than we're getting reimbursed from the insurance company, so that's going to be an issue. And venom, of course, is life-saving for our patients, so we've got to continue to provide that and work to make that work for our doctors. We successfully lobbied to reduce Medicare payment cuts to allergists, continue to invest in tracking state legislative activities that affect our patients and providers, and we're hosting regional town halls to encourage grassroots participation. You guys can help in all these efforts, working with Tanya and other groups. Other advocacy things, we've worked with the ALA on cleanup air for kids, supporting government funding for electric school buses. I worked with Senator Roger Marshall on improving seniors' access to care. Worked with the AMA, of course, on the No Surprises Act. Also worked to extend the payment adjustment. The AMA's, every year plans to cut 4% physicians and allergists. If all the cuts get implemented that could get implemented at the end of this year, we could take a 9 to 10% cut in our reimbursement from Medicare. And of course, everybody knows what inflation is doing. So you add those two together, that's a pretty big hill to climb when you're trying to run a practice. And I was mentioning earlier to some of the congressmen we were meeting, we actually in the last 3 weeks in our practice in Louisville had to cut visit spots down because we didn't have enough staffing to help, nursing staff to help. So I had to block visits. I couldn't get patients in because I couldn't get help. So again, that's going to be an issue that needs to be solved. Working with the AAP on pediatric funding. So again, as a college, we're always going to continue to advocate for our patients and our members to help increase access to specialist care and appropriate treatments. Continue to look forward to working with the Asthma and Allergy Network in the future. Thank you guys for everything.
Thank you, Dr. Corbett. That is a wonderful update of all things that are going on in the allergy asthma space and also at the American College of Allergy, Asthma, and Immunology. So thank you for being here. Next, we are going to hear from the Deputy Assistant Administrator for the Office of Air and Radiation at the US EPA. And again, we welcome Alejandra Nunez from EPA.
Well, hello, everybody. I'm really pleased to be here representing EPA in this very, very special day. And as Tonya said, EPA really cares about this issue and plays an important role on the mitigation front. Let me talk a little bit about that work we do. You all know that EPA's mission is to improve the lives of people with asthma. This is a high priority for the agency, for Administrator Regan, and also for us at the Office of Air and Radiation. Why? Asthma exemplifies the impacts of environmental quality and health burdens that really can affect everybody, but we know that especially people of color, low-income individuals, and also children suffer a disproportionate burden from asthma in different ways. So prevalence of asthma, severity of the disease, health outcomes, the use of healthcare, and the cost of healthcare, right? We think about those issues very seriously, particularly with a focus on the worst impacts on the communities with the highest exposure. So we all know that environmental hazards indoors, like moisture, mold, secondhand smoke, pests, pesticides, and combustion byproducts, as well as outdoor pollution, ozone, particulate matter, make asthma worse. So our work is really important to improve public health in two ways. We really think that good asthma care must include tailored interventions, both in terms of mitigating outdoor pollution, but also in reducing the indoor triggers in homes, in schools, as it has already been mentioned, COVID-19 brought the issue of indoor air quality to the forefront. We all now, it's very present in our minds how the air we breathe most of our lives is very important. But for EPA, this issue has really been a priority for many, many years. So let me talk a little bit about how we weave in these three very important themes today, how EPA's work helps increase access, affordability, and also innovation. So first, in terms of access, we work to ensure that all people with asthma have access to programs for comprehensive asthma care, and also obviously as our mission to improve air quality, right? So we provide tools for individuals, for communities, for homes, schools, and one of those is the website asthmacommunitynetwork.org, which has about 5,000 members representing about 1,100 programs. We provide a lot of information, and we also do a lot of technical assistance through webinars. So I invite you to look at this website, asthmacommunitynetwork.org. We have a lot of webinars that are saved online that provide a lot of very, very useful information to educate stakeholders around the importance of this issue. Second, on innovation, EPA helps spotlight the champions who are really working to help improve access and raise the profile of this issue. So as we all know, one of the things that EPA does is recognizing those programs through the National Environmental Leadership Award. So I know my boss, Joe Goffman, who is the principal deputy in the Office of Air and Radiation, announced the winning program for this year, the Utah Department of Health Asthma Program, which, wow, congratulations. So the program has achieved, together working with partners and through a lot of innovation, it has secured really, really impressive results that are so important because the 80% reductions that the program has secured in reductions in asthma hospitalizations really also translate into really significant returns on investment and cost savings. So in this case, $4 per dollar invested, which is very, very significant. And we really celebrate and really appreciate all the very amazing work that you are doing. Why? Because you are really helping, like by teaming with the state Medicaid, right? You are helping deliver services for low-income families, expanded access to rural areas, and really like figured out a way to get better reimbursement. So all the pieces together, we help and really want to celebrate you and want to invite everybody to go. Okay, so two things. First, to go to the website, asthmacommunitynetwork.org, because you're gonna find more information about the Utah Department of Health Asthma Program, more about this wonderful story that I just previewed very briefly. But we also have a webinar on May 24th, where we're going to share more information. So thank you very much for being here, and thank you for your leadership. And then the third thing on affordability, and this is also a really good example of how this administration really is championing the whole of government approach. EPA is working with Health and Human Services, Housing and Urban Development, and also with state, national, and community partners to expand healthcare reimbursement for home asthma interventions, particularly for disproportionately affected populations. We know that Medicare spends more than $10 billion annually to treat asthma in children and adults. So thanks to this, more children with asthma have coverage through Medicaid or the Children's Health Insurance Program. So we really are working together with all these other agencies in the federal family through the Federal Asthma Disparities Work Group to think through how we all come together and share our expertise, and with more resources, help to increase access. So we're really excited about the fact that it's becoming more affordable. This is our commitment. EPA's mission is to protect public health and to help mitigate and prevent environmental burdens. We are helping to increase capacity, and we believe that with more tailored funding, we really can deliver high-quality asthma interventions and also address the equity implications. I really want to thank you for your time, and I really want to thank the Allergy and Asthma Network for inviting us and for hosting this very important event. Thank you.
Thank you, Ms. Nunez. And now we have another one of our federal program partners from the National Institutes of Health, Dr. James Kiley, the Director of the Division of Lung Disease at the NHLBI NIH. We have had a long-standing relationship with Dr. Kiley in his division at NIH, and we have been advocating here on the Hill for continued federal funding for so many of the programs that he leads. Thank you.
Well, thank you so much, Tanya. It's really terrific to be here, and so wonderful to see everybody in the room after a long hiatus of being looking at each other across the computer screens. And for those of you who are still watching us across the computer screens, it's great that you were able to join us today. This is just a super event. As you know, it's Asthma Awareness Month. Yesterday was World Asthma Day. Today is a day to recognize on Capitol Hill with the leadership of the Asthma and Allergy Network the importance of this disease and why we need to advocate for increased efforts to get our hands around this in terms of new treatments and cures. So what I want to do, I think that Dr. Corbett did a very nice job of already highlighting for you why we're here. Tanya did the same thing. This is a very important condition, a disease. As we're learning more from the research, we know that it's a very heterogeneous disease. It's not a single entity, maybe more like a syndrome, but we do know it is the most chronic respiratory disease worldwide. So it is a huge problem, and it's one that we've already heard affects 25 million people, 1 in 13 have asthma, 5.5 million children. And we heard why that's really, really critically important, that we focus a bit on that population as well to improve their overall quality of life and their ability to learn, to play, and to lead very, very effective, productive lives. So I won't dwell on this because I think most of you in this room are very, very aware of the importance of asthma. So what I wanted to do, let's see, can I keep this thing going? Yes. You never know with the technology. So what I want to do today briefly is, it's been a couple years, but you know what I will leave you with is our asthma program at NHLBI, and I probably can speak for the National Institutes of Health, has been active, has been robust. We have been continuing to fund research in this area, and our investigators, patients, and all those who are part of this large family have been doing an amazing job during a very, very difficult time. And I think that all of us recognize that that has been trying for many, many individuals trying to conduct research. So I will try to tell you a little bit about what's happened over this period of time. We usually do this on a yearly basis, so I can give you a snapshot, but I'm not going to be able to cover all of it because there has been a lot going on. I want to tell you a little bit about the resources that we have available at NHLBI for asthma, a little bit about our ongoing asthma research, and then I'll touch just a little bit about ongoing activities in the future. So I think that many of you know that in 2020, we published the update of the National Asthma Treatment Guidelines, Treatment Management Guidelines. And here we highlighted 6 major topic areas where there's recommendations. So since that publication came out in 2020, we have kind of stepped back, and we now have taken what we call a 360-degree approach to dissemination of variety of different tools and materials that have all come from that guideline update. And we've now enhanced our digital and social media. We've done a lot of web events, CME activities for the professional community, and we created a lot of decision tools so that you can engage not only with, as a practitioner or a family member that has an individual with asthma, but also we can then communicate with our federal partners, the EPA and others that are very, very active in this space around the guidelines. So we use that as a centerpiece to help anchor our efforts about what we need to really push forward to get better control of the disease. So this is an effort for us to really kind of pull it all together. And again, you can see across the spectrum all the different materials that have spun off of that guideline effort. And I won't be able to tell you all about this. You can go to the website and you can really see this much more in detail. And I hope you do and you use it, because it's all there for you. That's why we have developed this material. And by you, I mean the patient, the family member, the provider, and it doesn't really matter how you touch this disease, in whatever way in which you touch it. This material, I think, would be very useful to you. On this webpage, you can find, again, a lot of updates. And we want to make sure that you know where to go. The digital toolkit is very neat. It has, again, tools for healthcare professionals. It has a lot of material that you can use. And again, many of you are very familiar with this. I know Tanya's group also produces a lot of this material. So together, we all kind of cover the spectrum here of material that I think would be very helpful as you manage individuals with asthma. One of the things that we've done this past year is that we've expanded our breadth of efforts in the national health education on respiratory diseases. And by that I mean that we have taken, again, a holistic view of respiratory health and disease. And we want to portray to the public how we're translating the research that we're supporting to make materials available to the broader public about why it's important that you understand how your lung works, why just understanding the normal respiratory efforts, and then how it all gets somewhat perturbed when you add disease to it. So our Learn More, Breathe Better program is our effort to take a much broader look across the spectrum. And what we've done is we've incorporated into our Learn More, Breathe Better program, our National Asthma Education and Prevention program. So they're forged together so that asthma is very, very prominent in this space, as well as our other respiratory diseases. This program started for chronic obstructive pulmonary disease, COPD, but because there's a lot of similarities between these two chronic airways diseases, we thought it was very natural to bring them together now. And we'll continue to expand this into other areas of respiratory pulmonary disease and health so that the public can get a better flavor for what's going on in this program. And what I probably failed to say at the very beginning, as I mentioned, we have a very robust program, but our research program at Nhlbi spans a very, very, very broad scope of work, from very, very basic science, looking at what's going on in the nucleus of a cell that may be involved in the pathway that leads to asthma pathogenesis, all the way up to dissemination of information, like what we're doing with the guidelines. So this is an effort, again, to bring it all together. Now, who's the target audiences? Well, I think that's, again, important that we try to make sure that we're tailoring our materials to those people who would best benefit from it. So anyone with symptoms of lung diseases or conditions, people at the highest risks for lung diseases are clearly important. We're targeting COPD, we're targeting asthma, we're targeting families, caregivers, and both adults and children. So it's, again, very wide. And all of the players, all the stakeholders that are involved, whether it's the health professionals, the voluntary organizations, the foundations, the professional societies, we believe we can kind of rally everyone around under an umbrella sort of program that provides that those important, well-developed evidence-based messages. So I want to pivot a little bit now and just finish the next few minutes with just a couple of tidbits of research that have gone on over the past year plus or so that I think are worthy of just kind of giving you just a general sense of. And I'm actually going to provide you with a little bit of the data for some of the statements that were made just a few minutes ago, because I think this is kind of important to see how the research is really playing out to bear on the materials that people are using to manage the disease and talk about the disease. So on the right side of this, I guess on your left side, sorry, the left side of this slide, this is again touching on what's COVID done for us over the past 2 years as a result, and in terms of asthma care. And I think this is important because we often get questions about, do patients with asthma do worse? Are they more vulnerable? Are they more at risk? What's happened in this era? Our research community has jumped on this and has done some pretty good work to try to uncover that. So the study that's on the way far corner here, the table that you see, I think you can mostly see it, is a study that compares the electronic health records from data coming out of Durham, North Carolina. More than 5,000 children aged 5 to less than 18 years of age with a diagnosis of asthma. And what they wanted to do is look at pre-pandemic and then compare that during a period where we were at the peak of the pandemic, March through February of 2021. And I think you can see that there's been a dramatic increase in the use of telemedicine in this population and in this time window. And you can see double-digit increases in telemedicine visits in 2020 to nearly 1,400 during the pandemic. So I think it was Dr. Corbett mentioned that his practice is seeing major increases. Here's the data, not just in Kentucky, but in other parts of the country, that telemedicine seems to be also very, very common. Use of how patients are interacting with the healthcare community. The second area that I wanted to highlight for you is the increased number of overall outpatient visits during the pandemic in this population, and you can see that's also been shockingly increased during this period of time. And then if you scoot over to the right side of this figure, I think the most shocking thing you see here is how the number of asthma exacerbations have really plummeted during this COVID period. So what we're seeing is we haven't cured the disease. We're seeing how people are accessing the healthcare system a little differently now to get help managing their disease. Another highlight from our research that I thought might be useful for all of you to just get a sense of is how are people accessing their information to be able to then process the material they need to understand how. So we've supported some research on how people are using the internet for health-related information as it relates to technology. And what's shown here, again, on the right side of this slide is using, again, a large data set of kids, teens, 12 to 16. This comes from Rochester, New York, where they examined students how they used the internet to get information about asthma. And I only pulled out a few significant items from the table that was in this paper. And as you can see, first of all, it's a minority of students who use the internet to get their health information, only 45%. But it's important to look at who is that 45, who are those people? Well, it's those who are roughly around 13 years of age. More females do it, and they're also associated with a much higher odds of poor asthma control, which is kind of the important message from the slide that you want to take away, that we want to make sure that if they access the information, they're accessing it because their asthma is not controlled. So if you look over on the right side of the slide, you can also see that using a very large claims database, this is more than 9,500 patients with asthma in the US who were treated with biologic therapy between 2003 and 2019, you can see that the number of people who got 6 months of therapy divided by those who had less, a 50% reduction in the exacerbation rate to those who had a greater reduction in exacerbation rate. I think what you can see, it may be a little counterintuitive, but those who had the higher exacerbation rate actually benefited most from the biologics. So again, the novel treatments, we need to figure out how to get those into the hands of those who will benefit from it the most and when to use it. So I think this is, again, playing out in terms of how we've been doing research over the past couple of years. As you can see, accessing large electronic health databases, looking at internet and how people are accessing it, looking at ways in which we can use the big practices and claims databases to really extract information about asthma. The other, one more on this one, it's a busy slide, but it's actually quite simple. This is some work that was done by Dr. Brian Stevens in Philadelphia. And what this takeaway here is that if you go in and mitigate in lower income homes in the greater Philadelphia area, and you make repairs, whether it's in the basement or in the attic, wherever it may be, you see huge decreases in healthcare utilization. And this is going to really improve the environment for children living in those homes that have asthma. So we're really very excited about these data. It's a small study, but I think the proof of concept is here, that these are interventions that we need to then take into account. We think always about behavior, we think about, medicines, drugs, and so forth, but there are other ways to intervene that can have also a very important impact. I think for our colleagues at EPA, we're absolutely spot on with this. I wanted to point out to you just one area that I think is deserving of maybe a bit more attention. This is a study that is the first to demonstrate that prenatal exposure of ambient ultrafine particles is associated with an increase in the development in asthma in both males and females. And it's independent of air temperature, exposure to NO during pregnancy, other things that could confound this. And this figure shows on the left side, the average concentrations of those in the study. This just happens to come from the Boston area. And you can see some clustering of where there's these ultra high particles and where the individuals, these pregnant moms, are basically exposed to those. And then you can sort of see over on the right side, the figure shows an increased odds ratio of almost 4.5 for the development of asthma in those children. So we need to get our hands around this because this is an understudied area. It's an emerging area. We need more data here. But what we're really concerned about here is we have a developing lung, we have a developing immune system, and we really need to make sure that we are not doing harm during those very critical windows of development. And that's where this study gives us a reason to be thinking about how do we intervene? How do we clean the air? How do we deal with many, many things that I think are also important as we take into account the different factors that influence asthma. So I want to just wrap it up a bit here and just kind of tell you a little bit about, again, ongoing and future activities. One of the things that has been going on for a number of years now is our TopMed program. This is a very, very big, almost 500,000 person database where we've done whole genome sequencing on all of those individuals. And there's about 6,000 individuals in that database with asthma. And what's the best database out there, not only to get a handle on the genetic basis of asthma, but also in terms of minority populations. There's a high prevalence of asthma, of African Americans as well as Hispanics in this cohort. And so we're looking really at various relationships of how the gene interacts with the environment, with other aspects of the disease itself, the clinical characteristics. And the hope is that we can identify new diagnostic tools and really focus on precision medicine and precise treatments for asthma. There's a upcoming inaugural event. It's a workshop on the International Collaborative Asthma Network. This is a collaborative that we've been working on for several years now to improve collaboration across all areas of asthma so that we can really hone in on best practices, look for preventative approaches, and best ways to treat the disease. In fact, this meeting kicks off at the end of this week. I'm very pleased to say that I'm involved in that one as well, so look forward to seeing you all again there. One of the other programs that many of you may know about is our Asthma Empowerment Program, and I'm very happy to say that in 2023 we'll have some results from that program. These are community-based programs. I don't have time to tell you all about that, but they have multi-sector interventions built into them, and one of the focus topic areas of these projects is around asthma disparities. So we should learn a lot more about some of the issues that are still unknown in terms of why various populations differ so much in their exposures and prevalence and incidence of asthma. And then at the same time, I want to just give a shout out to a very big initiative that's beginning to be pulled together at NIH related to climate change and the social determinants of health. Asthma has a huge footprint in that program. I'm very pleased to say all of our staff in the lung division at Nhlbi are very much involved in this effort, and it's an institute-wide program, very, very highly supported by our institute director, Dr. Gibbons, and it's being coordinated across NIH, led by our colleagues at the NIEHS. But we hope that this will be an early entry into how do we get our hands around some of the issues related to climate change, planet change, if we want to go beyond just the climate, and think about how it influences health outcomes, particularly in areas where we know they are critical, asthma being one of them. Various heart disease areas are very prone to exposures. So we really need to think about this, again, across domains and looking at it in a multidisciplinary way. And I think that the NIH is off on a wonderful direction to try to put some real significant programs in place that not just highlight the problem, but go after the solution. We're really into solutions now, because I think we've got a lot of data that tell us a lot about what the problems are. So as always, you can reach us at these websites. We have ways to catch us in many different venues, but please do reach out to us at any time. We're here to serve you, we work for you, and we really want to make sure that the materials we're creating are the ones that you want and that are going to best help you with your management of your patients. And at the same time, we want to make sure that our research is touching all of you as you interface with the population that we're trying to address. So with that, I'll stop. And again, I thank you very much.
Thank you so much, Dr. Kiley. I am so excited about so many of those programs and so looking forward to moderating and facilitating the ICANN meeting beginning later this week. It is an exciting time at NIH and what is on the horizon in research and development. As we conclude our time here this afternoon together, I have asked one of our board members and patient advocates to come and share a bit about why we must continue to have these conversations. It is no longer enough to just sit on the sidelines and to watch those numbers continue to rise. Watch that needless burden, the unnecessary deaths that we unfortunately get the calls about at the network day in, day out. And there is probably no one more just heartfelt and sharing my passion for this particular area, especially in the underserved community. And so, Ms. Leonis-Quinn, if you will come and please share your testimony with us.
Thank you so much, Tanya. Thank you for inviting me here. You know how I feel about you. My story, we talked about this morning about a why. My story is a why. Why is Anthony Jamar Chapman. He's my why. He's my son. He's 23 years old. He passed away from an asthma attack. And also my mother. I don't mention my mother too much because my mother and my son together is just a little bit too much. So I talk about my son the most. He was 18 months old. He was diagnosed with asthma. And he had severe asthma most of his entire life. And we had a pulmonologist. She was great. I loved her. Tony loved her. And when he was 7, Tony was 7, she retired. And we ended up having to go to another pulmonologist. They treated Tony well, got treatments there. He had all kind of tests, sleep studies. We went back and forth, changing the medications. Allergy shots, we did it all. That's, you know, his hospitalizations, a lot of missed school days. He turned 21, he opted out of our healthcare insurance. And after that, I practically begged the doctor, you know, please don't do this. Why are you doing this, number one? He's coming here his entire life, and where will we go? So they told me I would have to go to a free clinic after all these years, like 20 years probably, and to continue his services. So I found a free clinic. They did the initial assessment for Tony, and they never, ever, ever saw him again. Not ever. They told me I could come to their clinic to pick up his medications monthly. I did that. But in the meantime, Tony was in the emergency room more times than I could ever remember. That became our clinic, the emergency room. And probably about a year into that, Tony, I think he just kind of gave up. He was just tired of the back and forth. I think he felt the burden was on me to having to pay because I tried several times to get public assistance. I was denied several times. I was denied disability for him. They say he was not disabled, but he was disabled, could hardly work. So I think he just kind of gave up. He passed away. And to this day, I'm still heartbroken. I blame myself for years and years. I'm a nurse. How could this happen? You see this kid every day. You didn't see the signs and symptoms. You let this slide under you. So the burden of guilt was so much, suicidal, thought about killing myself. I can't do this anymore. And so now I energy those efforts into a foundation that I founded in Tony's name. And we do great works. So I think we do great works. We do asthma education. I'm a certified asthma educator now. We do asthma education. I supply air purifiers, mattress and pillow covers, and nebulizers and spacers. We do all kinds of things so that what I witnessed going through and still go through, would not happen to another family. There is absolutely no reason. There is zero reason why anyone should pass away from an asthma attack. There's no reason. I don't see it. I don't see a reason. Of course, it happens, but why is this happening? We need to fix the why for that. We need to fix the why of mothers are still burying their children. I've met so many moms who buried 3-year-olds, 15-year-olds, 12-year-olds. Why is this happening? I'm heartbroken every time I have to witness a mother tell me a story about how their child has suffered. So I thank you all for listening. I thank Tanya every time I see her. All of us together, we can do better. Thank you. Thank you.
Thank you, Leonis. And again, no mother should have to face that fear. No mother should have to face that reality. And no young adult should be faced with the choice of not having access to quality health care in this country. That is a shame. That is an absolute shame. And so that is why we are committed to these 5 policy priorities. It's why we and hundreds others out in the community, as well as here on Capitol Hill today, are advocating for these 5 policy priorities and some of the specific legislations associated with them. And so you can see here quickly, I'm not going to go through all these because, again, we've got support documents. We're having these conversations within different health legislators' office, with different legislators' offices and their health aides. And so again, just improving access to medical care and treatment, ensuring that we have appropriate asthma allergy program funding, making sure that we reduce the health risk for those asthma allergy emergencies, mitigating the environmental health hazards. Those cluster maps, Dr. Kiley, just turn my stomach, because we know, again, that that is a result of systemic injustice in this country. and then COVID-19 prevention and treatment. We will not rest at the federal level, at the state level, until these things are addressed. And so from state capitals to Capitol Hill, it's the voices of you, our advocates, that will be heard, that will continue to be heard. And we thank you again for your time, for your participation, and for your hearts for advocacy today. So on behalf of the network, on behalf of the staff that has helped us to be here today and to make sure that this was a successful event, and a sincere thank you from the bottom of our hearts, as well as to these sponsors. Thank you and have a wonderful day.